Like, okay, I can tell you would have really understood now how to break down questions. What would you say, like 6 months ago, what would you say your biggest challenge was prior, to starting?
To be honest with you, my biggest challenge then, in
Mm.
fact, I do not even know my biggest challenge until I met you.
Okay.
I did not know my biggest challenge because I don't know where I was missing it. So
Yeah.
I'm just like, I don't know what I knew something was wrong, but I don't know what was wrong. So
Okay.
I was missing what was wrong. So until I met you, that was when in fact, the first time that I did my interview with you, you asked me one thing about what is CHF. I will never forget.
Mm.
And I was like, it was like I was dumbfounded. As in, I was looking like like someone who have never heard of CHF. And I
Mm.
was like, oh my God. Oh my God. As in, this
Mm.
is bad.
Mm.
That I told my husband even after, I said, this is so bad. As in, someone asked me what CHF, and it's not that I do not know CHF, but at that moment, my brain was blank.
Yeah.
So I said, now this nursing thing, when someone asks you anything or when you see a patient, it means you should know what it is before they even started giving you the signs and symptoms and history and everything. I said that was my first intervention. Not
Yeah.
to talk of when we now had the discussion and everything, and I got into the program. Then later you told us that we should do the pre-assessment thing, that we
Mm.
will know where our weakest area is. But for me, I do not want to take the weakest area because I feel that I'm weak in every area. So
Yeah.
I
Yeah.
don't know which one is mine. So I didn't want to be focusing on the weakest area. So I just want to know what I want to do. That was when you now give us the 4 pillars that we need
Oh,
to
yeah.
understand. Yeah. So that was what broke down everything for me.
Mm.
So I now realize that my problem is the content.
Mm. Mhm.
So my problem was the content. Even when you told us that we should take our midterm exam, I told you that I wasn't ready because
Yeah.
I'm not comfortable with the content yet, that I
Yeah.
need to go back. So I kept on going
Yeah.
back to the content, to just get so that the same content, you asked me about CHF, I do not know. So I need to know the
Yeah.
content. So I kept on going back to the content that, when someone mentions something, I should, oh, this is this. So that was what I really worked on. I worked on other aspects too, though, but
Yeah. Yeah.
I really focused more on the content level.
That's good. And then,
Yeah.
what would you say are the three things that you feel like you got the most from the overall experience of the program? Like, what were the main things that you feel like made this different for you to pass?
Ah, how do I put it? I think, having this one-on-one interaction and being able to break it down this way, because like I said, I didn't know where I was missing it, but until I had that encounter with you, that first encounter, that what is CHF, that
Mm-hmm.
made me first of all know, okay, point number one, I didn't even know it was a content thing. I was just like, you do not know CHF, how will you be a nurse that you won't know it?
Mm-hmm.
So when you now broke it down again, there are this all these assessment thing that we have to on. I think it was on unit 0,
Mm-hmm.
all the things you need to know before you even start the program, like the weakest
Yeah.
area. I took the weakest area too into consideration, but it's not that I didn't work on it, but I knew that I was weak in every category. But
Yeah.
I didn't want to just focus on that because I feel like this is not really what the problem is, until when you now broke it down on each unit, content level, um, patho level.
Mm-hmm.
Yes. So even the patho too, there was, even in your teachings, when I started going through it, there are some times that we are just doing something, you will quickly explain the pathophysiology. And I'll be like, yeah, this is what I need to know. When
Mm-hmm.
you study a particular disease process, you should want to know the normal. If you don't know
Yeah.
the normal, you can't know the abnormal. So I'm always writing it down. Normal, I'll just put it in uppercase, normal. Without, you can't know the normal without you can't know the abnormal without the normal. So I am like, I have to know the normal one for this one. And also, when we are in class, you bring, like some teachings to us in the class, all those videos. Sometimes I'll be like, the videos, you might not see everything in the theory aspect, but the videos really shows you, oh, this is the real thing. Yeah, because I won't lie to you, most of the video thing, like in colostomy, the site for colostomy came out, and we just did it on the yes.
Oh wow.
So and we did it on the practical, on the class, when you showed us the video then. So honestly, I can't just wrap my head around it. Was I just, everything is what worked for me. Everything, even the teaching that you did. I remember one night when I was going through all those teaching, I think it was on the vault, when you mentioned something about people. Hold on, sorry. My husband was there when I was doing the teaching. 4 different types of NCLEX learners. So when you mentioned about independent learner, trained learner, and forgetful learner, specialized NCLEX learner, I had to categorize myself. My husband was even like, what category are you? I said, me, I'm the forgetful one. I said, but today, I said, thank God for no Chioma. At least you let me realize I'm a forgetful learner. So I said, I'm not going to be a forgetful one.
Amen.
And I try to, because everything I have, everything is in my notes. How to identify your weak areas. I went through everything, the truth about Satan, fastest way to learn many diseases as possible. In fact, honestly, even, and when you tell us in class that we should go and read a particular topic, there was a time you told us we should go and read maternity, this thing. I was almost on it for like 2 weeks. I was even thinking that I will be able to meet up till we meet for the next class. I didn't finish it. So and I'm always in a rush. I'm like, oh, Chioma has moved to another topic. But that thing kept on telling me that if you move to another topic and you didn't finish, just finish with this, even if it's going to take you a while. Just try to make sure you finish it. And when I was done with it, I think the following week we now went to what was it? I think it was something about that was when we did even when we did bronchitis and emphysema, and you gave us the video. It took me 2 weeks to do it, because I went back to the video, went back to everything, and I always, when you teach us in class, I will go back to the video, and I will go back to the book, the nursing book we bought on Amazon, to go and look at it again, and to really understand. In the end, I might not even study bronchitis and emphysema. I will even study all the units on that, on it, and things related to it. I will also do it. Then I just remember something now. There was a time in class too that you told us about lab values. That the things about lab values that you need to know. It is not just memorizing the values. It is for you to know if it is low, what does it mean? And if it is high, what does it mean? And what intervention can you do if it is low and if it is high? So I started writing down all the lab values and what it means. If there's, sometimes they will not give, like for low white blood cell, it's leukopenia. But in some cases, they will not say the person has leukopenia. They might say, oh, the person has a low, is on neutropenic precaution. It was on my test too. They said this patient was on neutropenic precautions and it was very low. They didn't say low white blood cell. And they didn't say leukopenia. So I'm like, yes, thank you, Nurse Chioma. She's,